Welcome to Module 14, Health Information Technology. This is HSC 4630, Understanding U.S. Healthcare. Presentation objectives include illustrate the benefits of health information technology, relate the trends in electronic health record adoption, explain the relationship of healthcare technologies to access to care, describe healthcare analytics, and describe HIPAA regulations related to data privacy and security. We're in the midst of what scholars are calling digital transformation in healthcare. The idea is that we use digital technologies to empower patients to become active decision makers in their medical care processes, offering information through portals and access through mobile devices. Patients who are involved and engaged with their healthcare decisions have better healthcare outcomes. In addition, we're looking to make our systems more integrated so that data can be carried from one provider to the next, from the hospital to a specialist to a primary care physician and across all continuum of care. And certainly the trends in hospital and physician electronic health record adoption, that digital transformation is well underway. Since about 2013, almost all hospitals have electronic health records installed. Physicians lag a little behind, although a large majority, have electronic medical records. Interoperable exchange of health information, or interoperability, is critical for delivering appropriate care and reducing healthcare costs. Dozens of healthcare information technology vendors provide services to hospital industry. Yet, as of 2021, only about half are able to share data across different EHR vendors. On these next few slides, I want to share with you some digital health technologies, such as telehealth, virtual care, patient portals, and hospital-at-home technologies. Telehealth grew 380% from before the pandemic to after, and it's since stabilized, but the big change was that Medicare now paid for primary care visits. The pandemic made what was a necessity speed up telehealth services, and to now is a staple of many primary care and specialty care and even inpatient care services. However, there are disparities in digital access. Between 15 and 24% of Americans cannot reliably access the internet or health technologies. The lack of internet access and digital literacy by racial and ethnic status is significant. Adults 65 and over are statistically less likely to be able to access the internet. Significant language barriers exist across major health platforms, and only 38% making under $20,000 have internet service. My colleagues and I did a telehealth study, Telehealth During COVID-19, Suicide Prevention and American Indian Communities in Montana. We did a survey of 80 behavioral health clinicians and nurses and physicians who are engaged in suicide prevention for American Indians. What we found was that there was an increased demand for health services via telehealth. In addition, they found that, yes, they can do suicide prevention, but there are severe access issues for Native Americans who are in big need of support services for suicide prevention. And during COVID, that was made much worse. Here's another application of telehealth. This is remote monitoring. Hospital at home is a way to expand the inpatient services to patients' homes, clinicians checking on them daily, and also having technologies monitoring the health and well-being, from blood pressure monitors to cameras to communication portals and more. Hospitals at home can effectively and safely care for patients outside of the inpatient setting. Until COVID, as Dr. Steve Ullman said in this article, telehealth was essentially non-billable, so there was no incentive to do telehealth. The article also interviewed me, and I said, this is going to seem like magic at first. Eventually, We'll become more comfortable with home hospitalization and its connectedness. Technologies are significantly expanding the opportunity to care for patients at home. Medicare beneficiaries could see approximately 3 to 4 times more at-home care by 2025. Medicare spend on services that could be performed at home by 2025 in billions. As you can see, acute care, that is hospital care, could grow to an $80 to $125 billion. Other services are also possible for care at home enabled through technologies. If you've been to Tampa General Hospital lately, you may have noticed this virtual care pod. OnMed is a Clearwater, Florida-based technology company. They build these self-contained exam rooms that are protected by privacy glass. The pods can take height, weight, body mass index, thermal imaging to read body temperature, and diagnose infection and readings of blood pressure, respiratory, and blood oxygen saturation. These pods are available to other healthcare systems as well, and they feel like the virtual care consultant feels more like a traditional doctor's visit, and it allows for affordable and accessible alternative to traditional brick-and-mortar clinics. It allows the physicians to connect virtually from anywhere and allowing more personalized virtual care experiences than telehealth. The OnMed Care Station can address 85% of typical primary care visits, including over-the-counter and most prescription medications at the time of a visit. Patient portals have become standard of care for all types of healthcare organizations. Patient portals allow patients to schedule appointments, get lab results, view recent doctor's visits, refill medications, send messages to their providers, fill out forms, and collect their medical histories, and much more. Patient portals are expected as a way to access healthcare and to make healthcare more convenient. Here's another example of using technology to keep people healthy. This is not quite as high-tech, but the texting service to American Indians was designed to help prevent suicides. These great texts have messages of positivity. You are a warrior, resilient, seen, valuable, worthy, enough. You are never alone. You have your ancestors by your side and generations worth of ceremony in your soul. Remember who you are always. I like these messages. I kind of wish someone would text me such positive messages every day. Can I count on you? Health analytics involves the collection, analysis, and interpretation of healthcare data to improve patient care, clinical outcomes, and operational efficiency within the healthcare industry. Healthcare analytics can encompass a wide range of activities and techniques, including scientific discovery, predictive analytics, clinical decision support tools, predictive analytics, and artificial intelligence. Scientific discovery. My colleagues and I investigated a data set from a health plan who collected information on whether individuals needed social care, such as food, services, education, medication, and housing support. We linked that data to healthcare claims that evaluated whether they were admitted to the hospital and readmitted to the hospital. We found that individuals who identified social service needs had 68% higher odds of readmission within 30 days. This gives a clue to how interventions can address social determinants of health to help reduce readmissions and reduce costs and improve quality. Predictive analytics is using data to make predictions about what might happen according to certain parameters of the data. You can use social determinants of health data, information about access to food, housing, transportation, education, and more, to predict health services. As shown in the previous study, similar data can be accessed through many healthcare claims data systems, including Z codes, such as Z59.62 means unable to pay for utilities. By looking at that information, you can use it to relate or correlate with bad health outcomes, such as readmissions. You can also use notes in the electronic health record to scan for natural language in the notes to do what's called natural language processing for automated extraction of the information, and then tie those parameters to predict health outcomes. However, there is a downside to predictive analytics. United Healthcare was using a product and service from Navi Health to help guide their decisions about post-acute care. That is, to allow hospitals and health systems to use post-acute care and how long to keep patients in those services, such as skilled nursing facilities and rehab. The new federal regulations found that the insurance companies using the analytics tools are expected to ensure that they are making medical necessity determinations based on the circumstances of the specific individual. The requirements say, as opposed to using an algorithm or software that doesn't account for individual circumstances. What this means is that predictive analytics were being used as a blunt instrument to reduce the amount of healthcare used in the health system. That is, they were declining to allow health systems use healthcare in order to save money, not making clinically appropriate decisions, but using the computer to make decisions for them. Data can also be used in clinical decision support tools, effectively allowing clinical guidelines to guide clinicians on what services to provide under certain conditions. It creates standardized workflow for the clinicians to evaluate any particular diagnosis or event according to rules set by algorithms and determined by expert panels of scientists and clinicians. It provides notifications and reminders for services. The pharmacy information systems alert prescribers of new drugs or proposing possible drug-drug interaction. This support helps reduce medical errors and improve patient quality. Artificial intelligence risk stratification. In healthcare, AI-driven risk stratification can help identify patients who are at higher risk for developing certain diseases or health complications. By analyzing various data points such as patient history, genetic information, lifestyle factors, social determinants of health, and environmental influences, AI algorithms can assist healthcare professionals in personalizing the treatment plans, improving patient outcomes, and optimizing resource utilization. While AI has the potential to significantly enhance the risk stratification process, it's essential to address certain challenges and concerns such as privacy, algorithm bias, and ethical considerations. Overall, though, AI-driven risk stratification can offer valuable insight and enable proactive decision-making and interventions to improve health outcomes and improve efficiency of care delivery. For example, AI can be used to prevent readmissions. Readmissions are where someone returns to the hospital after being discharged, usually within a short period of time, like 30 days. Hospitals want to reduce readmissions because Medicare does not pay for that readmission. Therefore, the hospital loses money. Moreover, they can get penalized for having too many readmissions, and Medicare will reduce their overall payments by 2%. Ouch. So AI can be used to prevent readmissions. Clinical data is incorporated into the risk prediction model, including diagnosis codes, vital signs, lab orders and results, medications, the physician notes, and any claims sent to managed care plans. Non-clinical data, including socio-demographic information, available from public and private third-party databases can also be incorporated. And data that were not available at the patient level can be used to match at the zip code level, such as areas with high levels of poverty, to predict readmissions. This data will give an idea to clinicians and health administrators about how to intervene when patients get discharged from the hospital. By categorizing them as high risk, certain interventions can be created, such as case management, phone calls, home visits, and more. Health Insurance Portability and Accountability Act is a law passed in the 1990s for which regulations were written to help protect the privacy and security of personal health information. In the next slides, I'll talk about HIPAA, its regulations, and the violations associated with the privacy rule and security rule. HIPAA regulations set the national standards for electronic transactions. The idea is to protect health information. Personal health information or individually identify health information related to the individual's past, present, or future physical, mental health or condition. The provision of health care to the individual, or the past, present, or future payment for provision of health care to that individual. HIPAA regulations. According to regulation, HIPAA applies to what's called a covered entity. A covered entity may use and disclose protected health information for treatment, payment, and healthcare operations and activities. This includes organizations like health plans, healthcare clearinghouses such as billing services, and healthcare providers such as doctors, clinics, psychologists, dentists, chiropractors, nursing homes, and pharmacies. These covered entities can expand the relationship to other organizations to be covered under HIPAA. These are called business associates, which are persons or organizations other than the covered entity that perform certain functions or activities on behalf of or provide certain services to a covered entity. All other parties should not receive protected health information. The HIPAA privacy rule is one of the major parts of the regulation. The goal is to ensure that individuals' health information is properly protected while allowing the flow of health information. There are major civil money penalties associated with the HIPAA privacy rule, and violations can go from $127 all the way up to almost $64,000 per violation. HIPAA privacy violations are taken very seriously. One is called snooping. A doctor at the UCLA Medical Center received 4 months in federal prison for looking at protected health information of coworkers and celebrities such as Leonardo DiCaprio, Tom Hanks, and Arnold Schwarzenegger. Protected health information breaches refer to an unauthorized disclosure of sensitive and private health information. This can include medical history and treatment plans, test results, and other sorts of information. PHI breaches can be very serious, and in one instance, a dentist was fined $50,000 for violating the HIPAA privacy regulation. In this instance, a patient posted a social media review to which the dentist replied in defense of their practice with protected health information such as the potential diagnosis and other such protected health information. The Oklahoma State University Health System was fined $875,000 for settlement for delayed of breach notifications. When there is a breach, the covered entity is required to report to individuals about that breach and provide any remediation necessary. In this instance, they failed to do so and were fined significant dollars. In another HIPAA privacy violation, Signet Health was fined $4.3 million for not allowing access for patients to their medical records. They denied 41 patients access to the medical records and then failed to respond to government inquiries. The penalty amounts were authorized by a law called the Health Information Technology for Economic and Clinical Health, or HITECH Act. The HIPAA security rule is a national standard to protect individuals' electronic personal health information by any covered entity. It requires administrative, physical, and technical safeguards to protect patients' protected health information. Administrative safeguards are those policies and procedures designed to ensure security measures to protect health information. Physical safeguards, of course, are regarding the equipment and systems to protect data from physical threats, environmental hazards, and unauthorized intrusion. An example of technical safeguards is controlling the access of protected health information, such as using passwords and user settings for allowing certain people to access data. Heavy fines for HIPAA security violations. Anthem, a very large health insurance plan, was fined $115 million in a class action lawsuit for failure to implement security controls. Victims of a series of cyber attacks executed by hackers compromised the EPHI of nearly 79 million people in 2015. Cybersecurity measures are critical for ensuring the protection and privacy of sensitive health information as required by HIPAA regulations. Cybersecurity includes data protection and encryption, access controls and authentication, and security incident response and reporting. Regular audits and risk assessments and training and education are absolutely required for organizations seeking to prevent hacks. Of course, the fines are huge and they get bigger and bigger over time. More than 90% of healthcare organizations have experienced a data breach of some type, and 34% of data breaches come from unauthorized access or disclosures. A lot of this has to do with phishing emails, allowing access into systems. And these security violations, more than 41 million patient records were breached in 2019. That's triple in 2018. Healthcare hackers are individuals or groups engaged in unauthorized access or cyber attacks targeting healthcare systems. They engage in what's called ransomware attacks, which involved malicious software that will encrypt the data, effectively blocking access to critical information until that ransom is paid. This can cripple a healthcare system, and so significant dollars is paid to invest in cybersecurity. In conclusion, there's enormous potential benefits of health information technology, not only to improve access to care, but also in enhancing health analytics to provide new tools for health services delivery. HIPAA, of course, is important for the flow of information between covered entities. Patient information, though, needs to be protected. Privacy and security are paramount, especially with the fines of HIPAA regulations.